to our Wellness Wednesday. Our health experts are with me now to answer your health and wellness questions. So please welcome back Melissa Sozik, physician's assistant from Kaiser Permanente, and dietitian Carrie Donat. It's good to see you both again.
Thank you.
So, Melissa, one of our viewers asked about jaw pain and can that be stress related at this time?
Yes.
Yes.
Yes. I'm just going to tell you right now. No, it's often a thing I see in clinic during this time of year and all year round, quite honestly, where when someone is resting during the night and they're maybe going to bed with maybe some of those stressful thoughts,
right,
and they either clench their jaw or they start grinding their teeth. And usually their dentists are the first ones to notice it, and then it's the pain that the patients come in to see me about.
Right. Yeah, actually my dentist gave me a night guard because of that. And so what is it that tips you off that that's what it is that's causing the jaw pain?
So sometimes the patient presents with ear pain actually because it's referred. The problem is actually at the TMJ joint, but the nerves are kind of misfiring in a way that they think it's their ear. And once I start asking more questions about trouble with chewing, or do they grind their teeth, or has their dentist said anything to them, they kind of start opening up and saying what's going on and asking about stress.
So what are some of your best stress release tips then? Yeah,
so I think, you know, having that, as I mentioned, kind of the sleep hygiene issue, winding down at the same time every day, turning off the screens, having a nice cup of tea maybe, warm compresses along the jawline if you're having some tightness or some clenching there, and seeking, you know, dental help when you're having too much tightness that you can't subside on your own.
A little deep breathing and meditation. Are there foods that can help us relax?
Well, I think, you know, a soothing cup of tea, which is more of a beverage, sometimes dairy foods kind of have a slightly soothing effect. And I think when it comes to trying to eat to help manage stress, just eating a healthy diet when you're supporting your body, that's just going to help.
And so what does that mean? So let's say I want to make sure I'm eating the right things. I'm not jumping up and down with my blood sugar, that kind of thing. What do I choose for a snack through the holidays?
Well, a good example of a snack would be, you know, I think yogurt makes a good snack, a piece of fruit with a small handful of nuts, or, you know, maybe like one of those Baby Bell cheeses or a string cheese. So you're pairing some quality carbs with fiber, with a little bit of protein and fat for balance. You know, it's healthy, full of nutrients, and it'll help kind of keep your blood sugar a little bit stable.
All right, so with that in mind, let's talk about going to parties. And you already mentioned, you know, don't go in starving and then destroy the cheese tray. Just, you know, have something healthy to eat before you go, and be hydrated. But in terms of just things to look for and things to avoid, what are our better choices?
Ooh, that's a good question. I said,
should I go for a little meat and cheese, the veggies? Try to stay away from the desserts. Does it matter? I mean, what's our plan?
Stay away from the off limits. Just look at what is sounding appealing to you, what you like to eat, and just watch how much you do, or how much you eat.
Don't just stand there at the buffet table. And Carrie, you've talked about this before, that it takes a while when you're hungry, you eat something, but you don't immediately feel full. So what's our strategy around that?
Yeah, well, it takes about 20 minutes for your stomach to communicate to your head that you've had enough to eat. So the problem is if people are eating really fast, you can kind of get to the point of fullness before you even know it. So choose what really looks good to you. You know, maybe get some veggies in there, get some protein and a little balance. Eat slowly. Notice what you're eating. Be mindful and kind of pay attention to how your body feels. Are you still hungry, or have you had enough?
That's really amazing that it takes, because in that 20 minutes that it takes to have your brain understand that there's enough in your stomach, you might have been eating for that 20 minutes.
Yes.
So eat a little bit, wait a while.
Yes, absolutely.
I call that happy full.
Okay.
Not too much, but I'm feeling good.
Yeah, I'm feeling good, but I don't have to just completely stuff my face. Let's talk about low fat versus non-fat.
Oh, I think we both agree a pox on low fat cheese.
No, I love cheese. Low fat cheese, no. No. Just from watching your amount of it, of course, but really we were having a conversation even off stage about it, and there's definitely been a real push for low fat foods, and now we're learning that not all fats are the same.
Yes, as Carrie's been telling us.
And that we're really looking long and hard at the cardiovascular impact of some of those fats that we used to think were really bad for us. And
do you know how confusing this is for regular people? I mean, if, for example, you know, if you're going for the Greek yogurt, do I want the full fat? Do I want the no fat, the non-fat? Sometimes the low fat has more sugar in it than the full fat, and I don't know what to do.
Yeah. That's a question I get all the time. I'll have new patients, they'll be, should I be eating like non-fat or full fat? And my answer is eat whatever satisfies you more. I do like people to go for plain yogurt and maybe add a little of your own jam to sweeten it.
Right.
But the research on full fat dairy is really interesting, especially for the fermented forms like yogurt and cheese. Even though it does contain saturated fat, which can have an impact on our heart, it doesn't, these forms of fermented full fat dairy don't seem to. It may be because
so I can go ahead with my full fat Greek yogurt if I want to.
Especially if it satisfies you more.
It does, and I like the plain just fine.
Some of my patients tell me they switch from non-fat to full fat dairy and they're more satisfied, and often their portion size is less. It's just so much more satisfying. There's so many things in dairy that have benefit for us. So
it's very tricky. So let's also talk about staying active in the winter.
Yeah.
It can be, you know, I'm in this big sweater that makes me feel like I'm just in a full nap even though I'm awake. And it's harder to get moving or to go outside. So how should we be thinking about our exercise?
Right, as we're talking about all the good foods we want to put in, it's also, I tell my patients all the time, it's great that you can go and have that piece of cheese or that piece of pie, but make sure that you're going and taking a walk. And yeah, it's
and you
the
burn
ins
more
and outs.
calories in the cold, I'm told. So that's a benefit. There's, yay,
Movement is
something that we
movement,
went
yeah.
on. All right, more New Day after this. Thank you both.